So as Jerry alluded to, the driver of the car was very intoxicated, going about 95 miles an hour. We're going about 60. It's one of these undivided highways in Denver. And, you know, it was a bomb that went off, frankly. My wife broke her neck and shattered her femur and, frankly, is, you know, paralyzed, confined to a wheelchair. But
today she's a quadriplegic. During this whole process, you had the unexpected opportunity to deal with our current healthcare system. Tell us about that.
It was a joy. It was a joy. We were in Denver, so we were out of our hometown of San Francisco. And after, I was still going in and out of the hospital for my injuries, and we were in Denver for a few weeks. But the first packet of mail I got, which was huge because it has all these bills in it, well, it included 2 letters from the hospital that my wife was in Denver. And there are 2 letters, both of which contained liens on our home in San Francisco. The hospital had placed liens on our home in San Francisco because Kim's medical expenses were so high. The hospital, because we were out of network, we were out of state, the hospital needed my pressure on my insurance company to get reimbursed. So they put pressure directly on me.
And you were you had good insurance.
Supposedly.
Supposedly.
Right? Supposedly.
Unbelievable.
So that was just the tip of the iceberg. And it only got worse, frankly. And the amount of mail and the amount of aggravation, not support.
Harassment. Harassment,
having to verify bills, having to go back and resubmit claim forms, the things coming in duplicate and triplicate and needing verification and resubmission of claims forms and whatnot, and always having to re-verify the accident. And it is a total mess. A total mess.
You know, with what you had to deal with, you must have some pretty strong feelings about where we are in this country right now with the healthcare reform. And what are your feelings about that?
It's unsustainable. I think healthcare in its current state is a bigger threat to our economy than any terrorist action ever could be.
Wow.
I really do. And it's self-induced, and it's needless, and you know, we all pay through the nose for supposed insurance, but insurance is only good if you don't need it.
Exactly.
As soon as I needed insurance, it really didn't come very easily, right?
How much?
The bills we got were so huge and so many, and they oftentimes don't come with cost, they come with some procedure code.
Sure.
Oh yeah, codes, right.
Tens of thousands of dollars that we spent out of pocket, and oftentimes because certain procedures were denied. Other times, for example, like certain durable medical equipment that my wife would need in her state of being paralyzed, insurance wouldn't cover, right? So
they dictated the term.
Insurance is the #1 evil in our healthcare system. And, you know, it's tricky here, right? Because the debate currently in Washington, and that's all the news item, is about health care coverage. And I don't think Americans want health care coverage. I think they just want health care. Now, I had coverage. I didn't have care.
Yeah.
All right. Now,
that's interesting.
It is
That's
interesting.
a very interesting statement.
I'll qualify that. The care that we received in the hospitals from the experts and the practitioners and the physicians, fantastic. But the process and the aftercare support that insurance is supposedly providing was abysmal. It's abysmal.
This is just so amazing that you were actually advised to divorce Kim.
Social workers meeting with all the people in the ICU, in the recovery unit, to advise them of what their options are. And typically it's about resources for counseling or, more importantly, financial aid, because these injuries are massive. And you know, I would say to anybody, look around, there's always somebody that has it worse. But the social worker met with us and outlining all these things, but it was very quickly apparent that we didn't qualify, because the minimum threshold for getting any kind of assistance, at least in California, is like $24,000 of net income. Well, I made more than that, but not so much that I wasn't going to be impacted by this incident. So I said, well, out of curiosity, what do people like us do? I mean, kind of normal folks. And she said, well, most people get divorced, because if you do that, and she kind of had this glint and you know, gleam of knowledge in her eye, she said, well, then one of you can file for bankruptcy and get all the kind of assistance you would need. And my wife and I looked at each other like, what is this? Right? It was a non-starter. And yet, of course, in these types of incidents, it's like 75, 80% people get divorced. First, I don't think reform is going to pass the way it is now. Forget about Massachusetts, but it's too expensive at the wrong time in our economic cycle. Right? It's
and only going to get more and more expensive.
Well, and just because a bill might get passed doesn't mean it'll get enacted and actually appropriated.
Okay.
We know how that game works,
yeah.
right? So this is a game of politics, not really policy. Personally, I think we don't need health insurance. I think insurance coverage is an unnecessary cost that we are bearing. We all pay into insurance, but how much do we actually get out of it? Insurance companies, be they not-for-profit or for-profit, make gobs of money. Well, who are they getting it from? So personally, I think the whole notion of insurance is somewhat superfluous because insurance is not health care. Insurance is a financial agreement for insurance companies. It doesn't serve our best interests.
Gil has just written a book entitled Shattered, Shaken, and Stirred, Reconnecting with What Matters After Loss and Adversity. The book tells a true story of what happened when Gil's family was involved in a head-on collision with a drunk driver. Thanks for being with us tonight.
Thanks for having me. Thank you.